I grew up in Cape Girardeau, and my dad was a general surgeon down there, and he actually trained up here at WashU. And when I was in high school and in college, his group every summer hired 2 or 3 late high school and college kids to hold retractors for their group. So I started early, and I loved it, and they loved having us there because I think that they enjoyed asking us questions and having us ask them questions. And over that, I did that for 4 years, and over those 4 years, I learned quite a bit about surgery and about technical operations. And when I went to medical school, I knew I wanted to be a surgeon. There was no question about that. And when I originally started medical school and even residency, my goal was to become a general surgeon like my dad in a relatively small town where I was able to do everything. As my residency progressed, I started to see that general surgeons are great for doing surgery, you know, for things that are straight up the middle. But when you started to get on the margins, I could see that you really wanted to try to develop a field of expertise. And the area that I enjoyed the most was operating in the abdomen. And so that limited my choices to colorectal surgery or hepatobiliary surgery or minimally invasive surgery. And eventually I chose colorectal surgery because it's got a great mix of doing cancer surgery for cancers that we're able to cure the majority of the time. We're able to do laparoscopic surgery, so minimally invasive surgery, other procedures like colonoscopies, smaller procedures like hemorrhoids and other anorectal procedures. And we get to operate on young patients with inflammatory bowel disease, and we get to operate on elderly patients with cancer. So it kind of runs the entire gamut of a surgical practice, and that's what I loved about it.